Most of us can remember a time that we went to the doctor's office and we were dreading it because we were getting stuck by a needle. And despite our tears, our parents would reassure us that it was all to help us in the long run. So what we were stuck with was probably a vaccine, which is just an injected that's given to an individual that allows their body to become more familiar with a certain infectious disease or virus so that we might not die from it if we're ever exposed to it again, but we're able to fight it off. But although vaccines are given to help us, some people think that they're harmful because of false studies. The bottom line is that vaccines are necessary to protect the public from infectious disease, and so anyone who can should say yes to vaccines. Despite rampant misinformation and myths, children and adults should be vaccinated to protect not only their health, but the health of others. So let's start with what vaccines are and why and how they protect us from infectious disease. So vaccines are just injections that are pretty much almost always given intramuscularly that contain small amounts of inactivated pathogens. And the pathogen is just a disease-causing microorganism or bacteria, virus. And so the inactivated pathogen is injected and it's attacked by the white blood cells. And some of these blood cells have memory and they catalog the pathogen. So if the body's ever exposed again to this infectious pathogen, the body can fight off the infection before it seriously harms the individual. It's important to note that although vaccines are not 100% effective, they are more effective than not being vaccinated. And also to note is that vaccination does not eradicate the disease, but rather it makes it harder to catch the disease. And just to name a couple common vaccines, there's MMR for measles, mumps, and rubella, DTaP for diphtheria, tetanus if you step on a rusty nail, and pertussis or whooping cough, varicella for chickenpox, and the most common ones are the flu vaccine and the shingles vaccines that we're supposed to get annually as adults. And some of these vaccines have been organized, or they've all been organized into a table by the CDC, perfect for parents and guardians to get their children ready for school. And vaccines help uphold what's called herd immunity, and it's a phenomenon that scientists have talked about lately. And it's just vaccinating all the people who were able to be vaccinated in order to drastically decrease the amount of people with the disease in a given population. So this protects people who are immunocompromised, who can't be vaccinated because their body can't defend itself against the inactivated pathogen. And immunocompromised individuals is just a fancy word for people who are like infants or patients with cancer or people with genetic disorders that maybe allow them to not have as many white blood cells. So essentially, herd immunity is just if more people are vaccinated, there's a lower chance for people to contract or spread the disease. So vaccines are made to be helpful, but some people have chosen against them, and this is because of falsified information that causes a widespread misunderstanding. So I'm going to debunk a couple vaccine myths. The first is one that occurred in the early 2000s. A Dr. Andrew Wakefield published an article in the journal The Lancet. It's a scientific journal claiming that he had evidence amongst patients that the MMR vaccine caused autism. It's important to note that his report was based on less than 20 patients under his care, and also to consider the fact that autism almost always presents itself earliest at age 2 to 4, which is when the MMR vaccine is scheduled by the CDC. So his findings are not statistically significant. His article was not peer-reviewed, and since in peer review, scientists have disproven his findings. His medical license was revoked. He doesn't practice any longer, but his misinformation has caused a pretty widespread misunderstanding. So it's safe to say that autism is not caused by vaccines. Another example is NMEs, or a non-medical exemption, which is qualifiable under the law in cases which a parent can refuse a vaccine on their child's behalf because of their religious orientation. And although some people can utilize this law and fit into the category with immunocompromised people, there's been a really big boost of people in New York who utilize the law and their parents who are hiding under this false veil of religion and getting the exemption for their child. And so that's been the cause of the big measles outbreaks there in 2019. And just an example, a quick little anecdote of what happens because of this misinformation. The CDC helped publish a story about an 18-year-old boy. His name was Ethan Lindenberger, and he discovered that he wasn't vaccinated when he was applying to university, something that we can relate to. And after the discovery, he decided to undergo the big, rigorous process of catching up on all his vaccines, and there's a lot of them. And so he tested on the Senate on the Health, and when asked where he got his information from, he said, well, I got it from the CDC, and his mother had gotten all of her information from Facebook and Twitter. So there's a lot of misinformation out there, and it can cause pretty detrimental effects on someone's health journey. So since all this vaccine misinformation is wrong, it's safe to say that everyone who can be vaccinated should. So what changes can you make today in regards to vaccines? Well, first and foremost, check to see if you're vaccinated. And if you aren't, then get vaccinated. At your next doctor's appointment, request a copy of your vaccine record or visit DHEC for a copy. And it'll tell you when you received your vaccines, as well as other information like where it was given, the muscle it was injected to, the doctor who ordered it, healthcare professionals who administered it. And then if you find that there's one that you're missing, a dose or just a whole vaccine in general, then contact your primary care physician and request that vaccine so you can protect yourself and others. You can also dispel vaccine misinformation when you hear it. So future healthcare professionals and educators have a unique position in which they interact with children and parents on a regular basis. So if you notice that a child is not vaccinated under your care, then gently educate the parents and ask why not, because they could be immunocompromised, but the parents could be misunderstanding about the vaccines. And if you're not in one of these career paths, dispel misinformation when you hear it, and report it if you see it published, and support politicians and policies that spread the truth about vaccines. And of course, if you have a child, get them vaccinated. So all this being said, there's lots you can do to help yourself and others stay healthy. And vaccines allow us to keep our bodies healthy as well as protect the health of people around us.